Hello, and welcome to this Anatomy Physiology Bio 201 video lecture on the bones of the appendicular skeleton. I'm Mr. Kennedy, and I'll be your guide as we explore this part of the skeleton together. The appendicular skeleton is composed of 126 bones. These bones are primarily concerned with movement. As appendages to the central skeleton, these bones include the bones of the upper and lower limbs and the bones of the girdles that attach the upper and lower limbs to the axial skeleton. The pectoral or shoulder girdle. The two pectoral or shoulder girdles include a clavicle or collarbone and scapula or shoulder blade, as seen here on this slide. Take a moment to familiarize yourself with each labeled structure on this slide. The clavicle or collarbone is an S-shaped bone. Its medial or sternal end articulates with the menimbrium of the sternum, and its lateral acromial end articulates with the acromion of the scapula. The scapula or shoulder blade is a flat bone that is located in the superior part of the posterior thorax between the second and seventh ribs. Its glenoid cavity is the attachment point for the humerus, which is the upper arm bone. The scapula is illustrated here. Take a moment to familiarize yourself with each labeled structure. The humerus. The humerus or arm bone articulates with the scapula proximally. Its rounded head fits into the glenoid cavity, and with the radius and ulna distally, the trochlea articulates with the ulna and the capitulum with the radius. This diagram illustrates the humerus in conjunction with the scapula and clavicle. You can also see the radius and ulna at the bottom part of the screen. Make sure you take time to familiarize yourself with each labeled structure in this diagram. The ulna and radius are the two bones of the forearm. The olecranon and coronoid process at the proximal end of the ulna form the trochlear notch, which wraps around the trochlea of the humerus, making up the elbow joint. The radius is located on the lateral or thumb side of the forearm. The articulation of its head with the capitulum of the humerus and with the ulna allow the forearm to rotate. This diagram illustrates that rotation. This diagram provides you with a close-up of the bones of the elbow joint. The carpal or wrist bones are 8 small bones that connect to each other by ligaments. They're arranged in 2 rows of 4 bones. The proximal and distal rows of bones are listed for you here. These bones will also articulate with the metacarpals in the hands. The 5 metacarpals or hand bones make up the palm and back of the hand. They are numbered 1 through 5, starting with the thumb. Their bases articulate with the distal carpals, while their heads articulate with the proximal phalanges. The phalanges are the bones of the digits or fingers. There are 14 in all. The thumb contains 2 bones, proximal and distal, while the other 4 fingers contain 3 each, a proximal, middle, and distal. This diagram illustrates the bones of the wrist, the metacarpals, and the phalanges. As with all other pictures, take a moment to familiarize yourself with each labeled structure. The pelvic or hip girdle. The pelvic or hip girdle is made up of 2 hip bones, the os coxa and coxal bones, that articulate with the sacrum posteriorly. Each hip bone is actually made up of 3 individual bones, the ilium, the ischium, and the pubis or pubic bone. The 2 bones articulate anteriorly at the pubic bone's pubic symphysis. There is a disc of fibrocartilage between the 2 bones. The three individual bones fuse into one hip bone by the age of 23. This diagram provides you an illustration of the hip girdle. Take a moment to familiarize yourself with each labeled part. The head of the femur or thigh bone articulates with the acetabulum of the hip bone as a ball and socket joint. The acetabulum is composed of parts of all three of the bones that make up the hip bone. The pelvis is divided into a superior and inferior portion by the pelvic brim, which is where the abdomen meets the pelvic cavity. This diagram will provide you both with an idea of what the pelvic brim looks like, as well as some of the other aforementioned landmarks in the pelvis. The area of the bony pelvis superior to the pelvic brim is known as the false or greater pelvis. The area of the bony pelvis inferior to the pelvic brim is known as the true or lesser pelvis. This diagram illustrates those. This diagram will provide a comparison between the false pelvis in pink and the true pelvis in blue from a different perspective. The male and female pelvises differ in several ways. The bones of the male pelvis are usually larger and heavier. Differences in the female pelvis are mainly associated with the requirements of pregnancy and childbirth. The female pelvis is wider and shallower than that of the male. This table will provide you with a detailed comparison of the female and male pelvises. The lower limb extremity. The femur or thigh bone is the longest, heaviest, and strongest bone in the body. The proximal end or head inserts into the acetabulum of the hip bone, creating a hip joint. The distal end articulates with the tibia, also known as the shin bone, and is covered by the patella or kneecap. This diagram will provide you with the first part of the lower limb extremity, which includes the femur. Take a moment to familiarize yourself with each labeled structure. This is the patella or kneecap. It is a triangular bone that develops in the quadriceps tendon. It articulates on its posterior surface with the femur. The lower leg consists of the tibia or shin bone and the fibula. The tibia's proximal end articulates with the femur and its distal end with the talus bone of the ankle. The tibial tuberosity on the anterior surface is the point of attachment for the patellar ligament. This is a detailed diagram of the lower part of the lower extremity. Again, take a moment to familiarize yourself with each labeled structure. The tarsus or ankle contains 7 tarsal bones. They are listed for you here. The metatarsus or foot bones is made up of 5 metatarsal bones, just like the metacarpals. They are numbered 1 through 5, starting with the big toe. They make up the sole and dorsal surface of the foot. The proximal ends articulate with the 3 cuneiform bones and the cuboid. The distal ends articulate with the proximal phalanges. The phalanges are arranged exactly like those of the hand. The big toe has a proximal and distal phalanx, and the other toes have a proximal, middle, and distal phalanx. This diagram will provide you with a detailed look at the foot and ankle. Take a moment to familiarize yourself with each labeled structure. The foot has 2 arches that are supported by ligaments and tendons. The purpose of the arch is to allow the foot to support the weight of the body. provide leverage while walking, and distribute the body's weight over the foot. The foot has two arches that include the longitudinal arch, made up of a medial and lateral portion, and the transverse arch. This final diagram provides you with an illustration of the arches of the foot. And this concludes our coverage of the appendicular skeleton.